Well, hello, hello, hello. It is Dorian Jackson, Women's Health Nurse Practitioner, and here we are. It is September, and we have our topic of the month, which this month it is vulvar cancer. And why even do all of this? Well, the goal here is I'm here to help you to be your women's health advocacy coach. So, what is that even all about? This platform is to educate you so that when you go into your doctor's offices or into the emergency room, you know exactly what the situation is about, or at least have a clue. You at least have a clue about what your symptoms are, what it could mean, what needs to be done, and how to really be in that space of being able to advocate for yourself, because it's all about education and understanding our own bodies so that when we go to these places and into these spaces, we're easily able to say, hey, this is what's going on, and know what the expectation should be as far as what our testing should be, and what we need to be getting done. So, ladies, this month we are talking about vulvar cancer. It's not really talked about that much. Not really, you don't hear much about it. We hear a lot about cervical cancer. We hear a lot about breast cancer. We don't hear a whole lot talking about the vulva. So we're gonna talk about that today. So even when we're talking about cancer, we're talking about cells that are just growing uncontrollably. Anytime we have cells that are growing out of control, they start to act up and they start to have changes in the DNA of the cell, which is pretty much it tells the cell to be what it's supposed to be and do what it's supposed to do. Once we start having changes in those areas in our cells, then that's what's happening with cancer. And those cells begin to be not normal and they continue to grow, and grow. So whenever we're talking about cancer in whatever organ it is, that's pretty much your basis for why it even goes down like it does. So now what is this whole thing about the vulva? So our vulva. First off, it is the outer part of the female pelvic organs. We have our inside parts, which is like uterus, ovaries, tubes, cervix. This is talking about the outside. So this is dealing with the lips, the majora are what those are called. Those are the outer lips, the labia majora. We're talking about the minora. Those are the thinner inner lips. That's the labia minora. We're also talking about the clitoris. So we're talking about all those outside parts. So these are the areas where vulvar cancer can actually show up. We're also going to delve a little bit into things like the Bartholin glands, and those are cysts that are right on the inside of the vagina, because that's part of the vulva also, and that's a place where cancer can show up. You may hear about cysts in these glands a lot, and they're very common, but at the same time, cancer can also form there as well, and a lot of times it is mistaken for an actual cyst. So that's where we're going there. Pretty much whatever, if you took a mirror and you look down there and you see what you see, that's the vulva. So we're talking about not normal cells growing in this area of our bodies. It's usually found in the inner edges, like in the inner parts of the outer lips and the inner lips, in that little crease in there. So that's where you're going to be looking when you're doing your self-exam once a month, which that should be done once a month. You know, we always talking about do your breast exams once a month, but we also should be checking out our vulva too once a month. So we'll talk about like how you actually would do a vulvar self-exam, so that way you're familiar with that. And if you feel comfortable with doing that, that's something that you can add into your routine practice, because the vulva is important too, y'all. We got to check her out. Okay, so here we go. There's several different types of cancers that are found in the vulva. So you can have anywhere from a squamous cell. We can even have melanoma down in the vulva, which is like crazy. I mean, that's very, very rare, but a lot of people have heard of melanoma. Skin cancers of any kind, they can show up down there. So sometimes it does start with those Bartholin's glands that are right inside the vagina. Sometimes it is because of human papillomavirus, which is HPV, but sometimes, y'all, it's not. You know, we blame everything in the kitchen sink on HPV. Bad pap smear, that's HPV. Genital warts, that's HPV. Cervical cancer, that's HPV. Genital cancer, it's all HPV. But there are types of vulvar cancer that are not from HPV, so that's not always the culprit. Now, where does this even come from? So we talked about the DNA changing and there being some changes in the DNA, and it makes the cells not be normal, and those cells just replicate, they just make copies. They just making copies. And that's where we can get things like tumors or like a solid mass, or even you might see just like a plaque or a mole down there that just doesn't look quite right. Sometimes your symptom is just like itching that just doesn't go away. And it's like, they done treated me for this yeast infection over and over and over, and it's just not going away. So those are the things that can happen. That's kind of like, where it comes from. It's because of this change that happens with the DNA. And sometimes, y'all, it happens for no good reason, just for nothing. So these are things that we do have to keep a lookout for if we do have any risk factors or if we do have HPV, but it's also something that we should keep on a lookout for even if we don't. Just because we don't have risk factors for something, that does not just totally negate us for having any risk of acquiring it or getting it. So that's why this is an important exam or an important discussion to have, just so that we can get comfortable and used to examining our bodies, checking stuff out and making sure we good. And if there is something that ain't right, we going and getting that checked out. Okay, so let's get into these risk factors. So age is a risk factor. Anytime, as we get older, there's always risk factors of different things showing up, but there's also a type, kind of like one of the types under the types of vulvar cancer that can even happen in children and young girls. That would be the type of it's a sarcoma, which that type of cancer comes from like connective tissue or muscle or bone. So, this vulvar exam, just being comfortable and aware, even with our children, is something that's, that's important. Not saying that we got to be checking them all the time, but it's just something to keep in the back of our minds. But typically this is something that we would see in older women. If we do have HPV, that's going to be a risk factor because, HPV does do what it does. We can't blame everything on it, but we can blame some things on it. So having HPV, that's also a risk factor. Smoking is a risk factor. Now, with risk factors, just because we have a risk factor, it does not guarantee that we're going to have a problem with this or that we're going to have vulvar cancer or anything else. But a risk factor is a risk factor. It gives us risk. The other thing is if we have like any kind of condition that could cause our immune systems not to function properly. So things like HIV infection, things like if we are taking drugs to suppress our immune system because we've received a transplant of an organ. So things like that. So that's going to give us risk. It doesn't mean that we're obligated to have a problem. It's just going to give us risk. So it just means we need to be more aware. We need to be more intentional just about checking, what we need to check. The other thing, okay, so now let's get more into these symptoms, because this is pretty much the main bread and butter about the whole situation. What you need to look for in the event that something's going on down there. There are ways that we can catch cancer before it gets to cancer, where we're looking to catch precancerous changes like cells before they get all the way to that point. So these are just some of the symptoms that can kind of cue you off that some further testing is needed and not just another yeast infection cream. All right, y'all, look. So itching that does not go away. Y'all know we done had yeast infections over our lives. You take some monostat, you good. You get yourself a little pill, you fine. But this is itching that doesn't go away. Because of course, if there's something like cancer going on, a little cream it's not gonna fix that. It ain't gonna fix that at all. So itching that doesn't go away and that's persistent. So this would kind of look like, like I said, we've been treating this and treating this and treating this. It's not going away. But, they keep giving me creams and keep giving me creams. No, we need to delve a little bit further and make sure that there's not something going on that's a little bit more in depth than just a yeast infection. So itching that doesn't go away. Another thing is pain and tenderness. Sometimes with vulvar cancer, as it progresses, we'll start to have hip pain because the mass, it grows like instead of growing like out, like towards the outside where we could see it like in the mirror when we look down there, but it can grow into the tissues. And if it spreads, it can start causing us to have hip pain. But definitely, having just tenderness down there for some unknown reason, swelling down there for just no reason at all. Pain with sex, we'll start to have that because if something's growing in there or in that area, and as it gets bigger and bigger, we can start having these kinds of problems. Things like an ulcer or like a sore. Like if you scrape, the top layer of your skin and it look raw, something like that. If you see something like that, these are things that are not normal that we should not see down there. And now sometimes if a nail's too long and we scratch there just not even knowing, that's one thing. But typically with this type of sore, if it's something like cancerous, it just won't heal. It doesn't heal, it doesn't go away, and it progressively gets worse. So those are things to look out for. Also random bleeding that's not associated with your period. Because sometimes what will happen is these tumors, like they'll start to bleed. If they break through the skin, they can start to bleed. So that's something to look out for too. Any little strange moles, and this will be a new mole if the border of it looks a little strange and not regular and smooth, if it looks like the shape is a little bit off, if it's something that's growing, these are things to look for. But that's the importance, y'all, of doing the self-exams once a month, because how are we gonna know if it's a mole down there doing what it's not supposed to do? We gotta look, because by the time it gets to the point where there is a tumor and all this, it's been there for some time. So if we're checking every month to make sure everything, looks like it's supposed to look, then you'd be able to pick up on something. You'd be able to pick up on something before we would, because child, you with your vagina all day long. You with your vulva all day. So you know her very well. You come into the office once a year, girl, if that, sometimes. So, I mean, you know what changes are going on in your body, and you're going to be able to detect even the smallest change. Okay, so what else did we say? We already talked about that. We talked about this. Okay, so yeah, anything like a lump down there, open sore, pain or burning with urination, like anything where you just not, we know when it ain't right. And when it's down there, we know when it ain't right. So even if, and look, y'all, every time we feel an itch, or every time, we feel something a little strange, some swelling, some, difficulty or pain with sex, something like that, it don't mean we got vulvar cancer. It don't, y'all. It don't. But at the same time, it does mean that we need to at least go get a checkup. We need to, make sure that we're being examined, enough testing is being done, that swabs are being sent off for things like yeast or bacteria to see if that's even what the problem is, that we're being treated appropriately for that. And that if it doesn't go away, then it's like, okay, well, what's our follow-up? Just to kind of make sure that everything is going along and it's not just a brush off. So what that would look like is if you have been being, treated for, skin irritation or eczema down there or different things and yeast and all this other stuff, and it's just not resolving, the only way that we can diagnose this is with a biopsy. So there would be a small portion of skin that would be removed. So of course it gets numbed up. It gets numbed up, y'all. I mean, that probably ain't the funness either, but it gets numbed up. And it looks almost like not really like a hole punch, but it's a tiny, tiny little circle of area that's taken off of the area where you're having the problem. We send that to the lab, and then the lab will determine what's really going on here. Is this something that's not normal? Is this some type of chronic inflammation? Because chronic inflammation down there can happen in our skin, and it can cause itching and itching and itching. It can cause skin discoloration. So there are other things that could be going on. But the point is, the only way we're going to know for sure is with that biopsy. I know that's not fun, y'all. We don't want to have to do that. And just the word biopsy is just like, no. But if we're going to be able to diagnose things and catch things before it, gets in an area we don't want to get into, that's what would be needed. And also, even if it is like one of those chronic skin infection type things, which we can have down in the vulva, we want to be treated correctly. And with some of these things, we need a strong steroid cream. Like Monistat ain't going to cut it. Even a prescription thing for you, like it's just not going to cut it. So those are just one of the ways too that you would know. It's just like the regular basic treatment. It's just not going to cut it. All right, y'all. So even once the biopsy, if that comes back, if there is something that's not normal, then the typical treatment there is chemotherapy, radiation, there's surgery, there's different ways to deal with it. So if you're going and you're diagnosed by your general OBGYN, they would usually send you to see a GYN cancer specialist, is how that would go. So the important thing here though, is making sure that one, every year you're getting checked out. It's very important to get our annual exams, even if it's not time for you to get the pap smear. I know everything changed with the guidelines and they're like, oh, paps are just every 3 years. Okay, that may be true, but exams are still every year and they're so important. We're not just checking for cervical cancer. We're not just checking for a breast cancer. Like that's just not the whole bread and butter. We checking for the whole situation. And that's going to count with the vulva too. Like we have to go to be examined because child, we ain't that flexible and we just can't see, like we just ain't that flexible. It's not going to work. We're going to talk about the whole thing with, doing our check at home. But even with that, we just ain't that flexible. We just not. So that's going to be important. And that brings us right into how do we, avoid and prepare, help kind of focus in on prevention. Like how do we live in that place? Definitely getting our checkups regularly. And if there's something that we're not sure about, we go in for a problem visit or for, a regular little visit, not with the annual. Don't say, oh, I'm gonna just wait couple months when I go in for my annual and get it checked. No, just go on in and just get it checked. My thing is, I'd rather you come in than sit at home and try to wait it out. I'd rather you, even if it's nothing, just come on in. That's what we're here for. Like, what we doing? Like, that's what we're here for. So come in to the office so you can be seen, see your healthcare provider so that way it can be evaluated. The other thing is, okay, some other stuff. Avoiding HPV, that definitely can include getting the vaccine. If you're up to 45 years old, you can still get the vaccine for HPV. It's called Gardasil, and it'll give you protection, not 100%. It does not protect you from all types of HPV, but it will give you some protection, and some protection is better than no protection. So definitely doing that if you're still within that age group. The other thing is not having multiple sexual partners. That goes right back to HPV. Now I'm gonna tell y'all, condoms don't protect us against everything. And definitely HPV is one of those things. HPV can be transmitted with just skin to skin contact. It can also be transmitted through fingers. So condoms, we gotta do that. But not having multiple sex partners, things like that. And can I just say this too? Like, if we are doing stuff like, with fingers and doing all of that, make sure he wash his hands first. Like, cause that's like a thing, but I mean, for many reasons, not just this HPV situation, just in general. I just want to throw that in there because it's just, we don't need to be putting bacteria and, things down there that don't need to be down there because it causes problems. But okay, not having multiple sex partners because that's just more exposure, or just being careful with our partner if they have multiple sex partners, because then that's just more exposure for us. So we want to try to avoid HPV at all costs. HPV is very, very common. About 80% of women have it. So if we already have HPV, very well. That does not mean that you're going to get vulvar cancer, cervical cancer, or any of that, but your follow-up appointments and your checkups are very important. The other thing that we can do is not smoking. So not smoking, because if HPV and smoking, that's just a bad combination, because smoking, so that nicotine and those chemicals and toxins, that's going to allow HPV to be more aggressive, and we're not even trying to have all that. So not smoking, and smoking weakens our immune system, and also it gives us risk for other cancers too, but not smoking is definitely going to be on our side for us not getting vulvar cancer. Doing our annual GYN exam, we talked about that. Okay, so doing the self-exam monthly. So what this would look like is you take one leg, if you can, put it on your toilet seat, and then you stand with the regular leg. So you got like one leg propped up on the toilet seat, you're standing with your other leg, you take a mirror and you just look down there. You just look, you separate the lips, you look through the hair. If you have any, you're just looking for any swelling, any places where the skin looks different. You're looking for strange moles. You're looking for areas that are bothersome, but you already know if something bothersome, if something itching, burning, just hurting, we gonna know that straight up. We don't even got to look. But that would definitely be something. We're looking for the things that you wouldn't feel. So like a rash, you wouldn't necessarily feel, or, just like a strange mole showing up, you wouldn't necessarily feel any pain or discomfort with that. But looking down there once a month, and all you have to do is that. Now, if you're not able to, put your leg like up that way, then you could easily, if you're laying down, you want to prop your head up on some pillows. If you're laying down flat, you would put your knees up, put your feet together, and then you let your knees just fall out. So it's almost like the bottom part of your legs, it'd be like almost in like a diamond shape in a sense. And then you put the mirror there. But because your head is elevated on the pillows, you'd be able to at least see somewhat with the mirror. Now that one's a little bit trickier because, you got to try to see, it's just the distance is a little bit different. If you do have a partner that you feel comfortable with having your partner check, I mean, whatever it's going to take just to make sure that down there, everything is healthy, is doing what it's supposed to do, and we're not missing anything. And then, if you need to go into the office, like any findings, anything you find that just don't look right, don't feel right, just go in. And then that way we can, sit with you, examine you, do the correct testing, and be able to send it out to really let you know what's going on. So that's what we got for this month. Videos are coming out the 15th of every month. So we're going to see what's up. And then, I don't know, if I feel froggy, I may have some other stuff come out even outside of the 15th. But we're going to see. But at least the 15th of every month, you will find me here. So like this, subscribe to my page, tell your friends, send this to them, because everybody needs to know about this vulvar cancer situation. You can find me on Facebook at Her Answer, Instagram, Her Answer Now, website, heranswernow.com. So I'll see you guys next week. Reach out to me if you need to with any questions. Thank you for watching, and take care of yourself. You are worth taking care of. And I'll see you guys soon. Take care.